Thank you very much. The next question, the member for Cambridge.
Thank you very much, Mr. Speaker, and good morning. My question is for the Premier. During this period, it is important that the government avoid providing inconsistent or false information. As mentioned on Sunday, the Toronto Sun reported that the Premier had no idea two of his MPPs.
The member to withdraw.
The Toronto Sun reported that the Premier had no idea two of his MPPs signed a letter to the Chief Medical Officer of Health. On Monday, the Premier said he knew the letter was coming and even urged it. Later, CTV reported a third version of the story. I was hoping the Premier could tell us which version of the story is correct. Did he know and urge his MPPs to lobby the Chief Medical Officer of Health, or did he not know? And why are sources in the government providing different versions of the same story to the media and the public? Doesn't the Premier believe that inconsistent information to the media during a pandemic only works to erode public trust?
The Government House Leader to respond.
Thank you very much, Mr. Speaker. I think I answered this yesterday in the House. The member for Burlington and the member for Milton were responding to what was a difference of opinion between the mayors and the Chief Medical Officer of Health of Halton with respect to Stage 2. The two members wrote to Dr. Williams in an attempt to help offset or break that logjam, Mr. Speaker, so that they could provide additional data. I think it's something that we would, hopefully all members would act in very much the same way. The member is quite correct in suggesting that the Premier had already spoken to the Mayor of Oakville and was aware of the issue, and of course the member for Burlington spoke with the Premier and let the Premier know that a clarifying letter to help break this logjam in Halton was coming forward.
And the supplementary question.
Mr. Speaker, another inconsistency in the information provided yesterday. The Premier said he told local politicians in Halton to push back against the Chief Medical Officer of Health if they weren't ready for another lockdown, suggesting that it was the Chief Medical Officer telling the Premier to consider this move. But the Chief Medical Officer of Health told CTV News he made no recommendations, and neither did any local Halton Medical Officers of Health. Which version of the story is correct? Why the inconsistency in information provided to the public? Is the government okay with confusing the public or not? Or is this the government's way of passing the buck?
Government House Leader.
Again, Mr. Speaker, I think it's actually fairly obvious that there is a growing disagreement between especially the mayors of Halton and their Chief Medical Officer of Health. If I'm not mistaken, Mr. Speaker, the Chief Medical Officer of Halton added extra measures beyond some of the measures that we had introduced in the region that the mayors were not supportive of. So there is a disagreement between elected officials in Halton and their Chief Medical Officer of Health. We, of course, encourage them to work together. I applaud both the member for Milton and the member for Burlington for trying to do their best to break the logjam between the two. The member is quite correct. When there is an inconsistency between elected officials and the medical officers of health, it does raise problems, and it is our job to make sure that that we close that gap, Mr. Speaker. That's what we have been doing. Right from the beginning of this pandemic,
Response?
On the advice from our medical officers, and again, I applaud both members for doing what we would expect all members in this place would do when it comes to disagreements between their medical officers of health.
Thank you. Thank you very much.